Thank you all for joining us as participants. As you come into the room, we are giving everyone opportunity to come in. Thank you so much for joining us for the Employer COVID-19 Vaccine Symposium, hosted in partnership, Greater Memphis Chamber and University of Memphis. I'm going to give everyone a few moments to join us. Thank you all for joining us. We're very happy you're here. We're going to give it about 30 more seconds and we'll get started. Good afternoon. Thank you all for joining us for the Employer COVID-19 Vaccine Symposium. Grateful for those of you who have taken time during lunch hour here on Thursday to join us for this important conversation. I am Bobby White, Chief Public Policy Officer with the Greater Memphis Chamber. I want to again appreciate you for being with us on this afternoon for this important conversation. We're probably right over a year into a pandemic that has gripped our operations and tremendously impacted how we've done business over this last year at every level. And so we're grateful for this opportunity as we look at what's next. And as we are in the phase of vaccines and vaccinations being given out, we wanted to have this important conversation with our business leaders, employers, employees, in the Greater Memphis area. And so we're grateful for the partnership between the Greater Memphis Chamber and the University of Memphis getting us together, as well as our other partners and folks who have been associated with this effort. We're going to start us off in great fashion with two great leaders who are the leaders for our partner organizations. And I'm going to introduce them at this point. We have Beverly Robertson, who is the president and CEO of the Greater Memphis Chamber. And we have Dr. Rudd, who is the president for the University of Memphis. Two great leaders who are doing great work in our marketplace and who have been great leaders during what has been a very difficult time for us this last year. So with that said, Beverly, Dr. Rudd, floor is yours.
Well, let me, Bobby, say thank you for that introduction, and let me welcome everyone today about really a critical issue and one that requires us to work as partners to be able to respond and manage such a difficult problem. I would add that Manoj Jain and I wrote an editorial that was in the Commercial Appeal, I believe yesterday, about partnering to contain the COVID virus and how important that is for us to work together around such a critical issue. So I want to say thank you for all of those that have helped us and worked with us as we have managed this problem and moved from containing a problem to actually working on vaccines. So I look forward to the discussion today. Glad you are with us and look forward to hearing what people have to offer. Beverly, I'll turn it over to you.
Thank you so much, Dr. Rudd, and thank you, Bobby, as well. And on behalf of the Greater Memphis Chamber, we are honored to co-present today's webinar with the University of Memphis. And now more than ever, two great institutions are coming together, striving to build a stronger, more resilient Memphis community together. We share the same passion when it comes to economic development. We're determined to make Memphis the #1 choice city in which to grow a business. That is why today is so critical. A little over a year ago, we all faced this pandemic together with uncertainty. And as we've said many times, there's simply no playbook for how businesses manage through a pandemic. As the vaccines roll out and become more widely available to everyone 16 years and older, there are questions that we as employers face. And today we want to assist you in answering those questions and determining how best to communicate with your employees. Again, thank you for being here. Thank you, Dr. Rudd, University of Memphis, for this outstanding partnership. And Bobby, it's back to you.
Thank you, Beverly Robertson. Again, two great leaders who have done yeoman's job during what has been a difficult year for businesses, for institutions of learning, for people at every level. And so we are very appreciative for Dr. Rudd and Beverly Robertson for your leadership through a pandemic, a global pandemic that has impacted us all. I want to again appreciate the partnership between the Greater Memphis Chamber and the University of Memphis. I am going to take this personal privilege, point of personal privilege here, just to name the names of individuals who worked to get us together and to go from the concept of us starting this to where we are today. I love to call the names of Matt Walker and Kimberly Fedoria, Amy Daniels with the Chamber team, and Anna, my friends. And so we have partnered, and we really appreciate the partnership between the University of Memphis and the Greater Memphis Chamber, getting us today as we seek to give insight and provide a perspective to these partners and business leaders from across our community. The person that rounded out that team that worked to get us together, in addition to folks like Sarah Burnett and other folks from other organizations, was also Dr. Vicki Nolan. And at this point, I'd love for Dr. Vicki Nolan to join with us to actually share with us the results of an employer-employee survey that was a part of our convening, something that we wanted to get and insights we wanted to gain, perspective we wanted to get. We got it through this employer-employee survey. And with that said, Vicki, please come right on. The floor is yours.
Hi, everyone. Welcome again. So I will be presenting today the findings from the Employer and Employee Needs Assessment Survey. So to better understand what to include in this symposium and the presentations we will be putting together in the weeks to come, we created this survey to gather information about businesses, employee characteristics, the knowledge, the attitudes towards the COVID vaccine, behaviors and barriers and needs. The survey was sent to 542 employers, February 16th through the 23rd, and 56 employers responded. The survey was also sent to 4,667 employees during the third week of February. Employees were instructed to forward the survey on to anyone who may not have received the survey, and it was also sent to 4 additional organizations, and they were instructed to forward it on to their members. 321 employees responded. Oh, next slide, please. In the business sector, respondents, the employers were members largely of the business and professional services sector. They represented 39% of the respondents. The remaining business types were fairly evenly distributed, and you can see them here on this slide. Next slide, please. Among the employees, they also largely represented the business and professional services sector, but this time they only represented approximately 21% of the respondents. And this time, education and advertising and media was also represented. Again, the remaining business types were fairly evenly distributed amongst the respondents. Among the employers, they reported that most had fewer than 250 employees. 27% had between 51 and 250 employees, 22% had between 11 and 50, and 31% had between 1 and 10 employees. The remainder had greater than 250 employees. More than half, so approximately 55%, had more than one location. At the time of the survey, approximately 68% of their employees were working in person, 37% were working remotely, and 14% were working hybrid. Next slide. Among the employee respondents, most of them reported that they worked at businesses with fewer than 250 employees. 39% worked at businesses with 51 to 250 employees. 28% had between 11 and 50, and 12% had between 1 and 10. Most were full-time salaried employees, 85%. And at the time of their survey, 36% were working in person, 37% were working remotely, and 27% hybrid. Next slide. So we had asked the employers what percent of their employees did they think would get vaccinated. They reported that they thought most of their employees would get the vaccine. So 64% reported that they thought 75% or more would get the COVID-19 vaccine. 29% reported that they thought between 50 and 75% of their employees would get the vaccine. Next slide. We also asked employers what they thought were the barriers to their employers getting vaccinated. And by far, access and personal opinions about the vaccine were the largest barriers to getting vaccinated. Next slide. We also asked both the employers and employees how likely they themselves were to get the COVID-19 vaccine. Most were either likely or very likely to get the vaccine. So 96% of employers were either very likely or likely to get the vaccine. Since the employee survey was slightly later than the employer vaccine, we included those who had either one or more doses of the vaccine in the very likely category for the purposes of this presentation. So 86% were either very likely or likely to get the vaccine. Next slide. So we asked the employers, how important was it to them and their company that their employees get vaccinated? 79% reported that it was very important, and 17% reported that it was somewhat important. So that's unsurprising, given that being vaccinated is probably very important to them continuing their businesses. Next slide. We also asked a similar question of the employees. Employees responded according to the employees, that it was very important that the employee get vaccinated. Sorry, this is a confusing question. So how important is it to your employer that you receive the vaccine? So 71% of employees thought it was very important that they get vaccinated. 21% thought it was somewhat important. So to remind you what the employer's answer was, that's in light blue. So the employees and the employers are very much on the same page. They agree that it's very important that they get vaccinated. Next slide. So we asked the employees, what do they feel are the benefits of the vaccine? So this was a question that was check all that apply. This is why none of the percents add up to 100. So they felt that it would protect them from the virus. It would protect others from the virus. It'll restore some sense of normalcy, and they'll be able to resume travel. Interestingly, not many respondents said it would ensure job security. The reason for this is likely because these are people who are still employed. A year into the pandemic, they still have their job. So they're probably not that concerned about job security because they've made it through a year and they still have their job. Next slide, please. So we also asked, why will you not obtain the vaccine? So this question was limited to only those who replied either unsure or unlikely to that question about will you get the vaccine? Because we wanted to know what are the potential reasons for vaccine hesitancy. So the responses here were that people don't trust the vaccine. I have religious reasons. I feel the vaccine was created too quickly. I feel the vaccine has become too politicized. I don't believe that COVID-19 is a serious threat to my health. We asked this question because we want to know what is the messaging? What do we need to put in this vaccine symposium so that people know how to communicate with their employees? Next slide, please. So other reasons we found were They don't believe that that they themselves receiving the vaccine is a benefit to others. So we need to communicate how receiving the vaccine can prevent community spread. They have concerns about the safety, concerns about side effects. I'm not sure that the vaccine is necessary. And we included an other because we wanted to know what other vaccine myths or misunderstandings we would need to combat. So a lot of the answers there were things about concerns about the new vaccine type, the mRNA vaccine type. There's misunderstandings out there about that this isn't an actual vaccine, that it's gene therapy. There's concerns about the vaccines in either women who are planning to get pregnant or who are pregnant or who are breastfeeding. There's other people who are just vaccine hesitant in general. They think that it's poison. So these are all things that we need to address in our public health messaging. Next slide, please. We also asked what they felt the barriers to getting the vaccine was. So again, this is specifically addressed to the employees. Actually, they didn't, there weren't that many barriers addressed except for access and personal opinions. There's one that came up frequently, but that's unsurprisingly. Next slide, please. So largely it was centered around, I'm not currently eligible under the vaccine phase. So again, to remind you, this was late February, early March. So when this survey was sent out, we were still in the phase where it was 65 plus. So given the age of the respondents, most of the people were not eligible yet. So hopefully this will be addressed now that the vaccine rollout is, it's going to be all adults shortly. Next slide. We also asked them what support they needed from their employer. Some people responded that they needed time off because again, in late February, we were still dealing with, fairly long lines. That has greatly been reduced. I've gotten a dose, half hour in and out. Providing vaccination on site and other. So this was really interesting to me. We actually didn't provide I don't need support option. A lot of people responded, none. I don't need support. This isn't my employer's job. We just need more access to vaccine, or I need information. I need to know how do I make the appointment? Where do I go? That was the information, that was the support that they were looking for. So time off and access to the vaccine was kind of the support that they needed. So providing the vaccination on site was a big one, and information. Next slide, please. So going back to the employer side, to address the barriers, to address the support, we had asked the employers, what support are you willing to provide? So we had asked, would you be willing to provide time off so that your employees can get the vaccine? 87% said yes, they would be willing to provide time off. Next slide, please. We asked them, would they be willing to provide transportation for their employees? Only 21% said yes, but 22% also said maybe. 58% said no. Next slide. We also offered, would they be willing to provide the vaccine on site if it became available? 63% said yes, and an additional 13% said maybe. An additional question we had asked, if you were willing to provide it on site or were considering it, would you know how to go about that? 80% of respondents said no, they had no idea. They did not know how to schedule it. They didn't know how to contact, who to contact to go about getting that done. So we realized this is important information that needs to be provided and needs to be provided widely available for people to access, is if they were to arrange on-site vaccination, clear, concise instructions on how to go about that. Next slide. So another thing that we wanted to address is, how do we get this information out? So we asked employers, what is the primary method of communication in your organization? Overwhelmingly, the most common answer was email. We also asked employees, what is your current most common method of communication, but more importantly, what is your preferred method of communication? Employees' preferred method of communication is also email, 60%. Mainly, there are some others. So given our current, everyone working at home, a lot of people said, in-person meetings or Zoom meetings, but by and large, email is the preferred method of communication. So this is important to us because our goal of our group, the Chamber, University of Memphis, the people working on this project, are to eventually try and get together to provide communication tools that we can provide you to help give you the information how to provide vaccinations on site, information to help combat some of the COVID-19 myths, things that you can help educate your employees, to help increase COVID-19 vaccination uptake. And that's it. Thank you. I appreciate your time.
Thank you so much for that, Vicki. We're going to pitch it over to if there are any questions. I know that we are going to, at this time, pitch it over to Matt, who will take us a little bit further. With that said, Matt McDaniel, we'd love for you to join in on the conversation and take us a little further into introduction of our special guest.
Well, thank you so much, Mr. White. I appreciate it. Yes, it is. I'm with like you said, I'm Matt McDaniel. I'm with the College of Health Sciences at the University of Memphis, and it is my distinct pleasure to introduce Dr. Michelle Fiscus here today. Dr. Fiscus is a board-certified pediatrician who practiced general pediatrics in Franklin, Tennessee for over 17 years, and she is now the medical director of the Tennessee Vaccine-Preventable Disease and Immunization Program at the Tennessee Department of Health. She's also an associate clinical professor in the Department of Pediatrics at the Monroe Carroll Jr. Children's Hospital at Vanderbilt. She's a past president of the Tennessee chapter of the American Academy of Pediatrics and now serves on the board of directors of the American Academy of Pediatrics as a District 4 vice chair. And Dr. Fiscus, I'll let you take it away. We're happy to have you here.
All right, thank you. It's wonderful to be with you. Thank you for your time this afternoon and the opportunity to share some more information about this really important topic. So I'm hoping, it sounds like I'm going to be preaching to the choir maybe a little bit here, which is great. What I'm hoping that you'll get from the next 20 minutes or so is not only some reinforcement of things that you may already know, but maybe some good talking points that you can use to help people who either work for you or friends or family make informed decisions around the choice to get vaccinated. So just to give you a little bit of background about the vaccination program in Tennessee, under Blue Skies, our program runs the Vaccines for Children program, which is an entitlement program that provides vaccines to children who are uninsured, underinsured, or insured by TennCare. And through that program, we manage about 2 million doses of vaccines that are delivered to about 800,000 children across the state every year. So when it came to operating a pandemic vaccination program, this is something that's built on a pretty solid foundation of running immunization programs in Tennessee. We also manage the Tennessee Immunization Information System, which is an online registry of vaccinations that hopefully everyone's records will be in eventually, so that if their doctor's office closes or their immunization card from when they were 5 gets wet, there will be an enduring record of those immunizations that everyone can access. We have about 70 million vaccinations already up in the cloud so that people have those records when they need them. We also manage the Vaccine-Preventable Diseases Program, which means that we respond to outbreaks or threats of outbreaks of vaccine-preventable diseases such as measles. Memphis has had at least an opportunity or two of dealing with measles outbreaks. We also had a hepatitis A outbreak that pretty much racked the state for about a year and a half and ended, fortunately, right before COVID began. And so we also manage that, make sure that people get post-exposure prophylaxis, and that we investigate clusters and understand how vaccine or how infectious diseases move through populations. And now with COVID-19, we also run the pandemic vaccine allocation and distribution program across the state. So, interestingly, when COVID-19 first was identified, it came under our zoonotics, or our animal diseases program, because it was had its origins in bats, and so that's where its home was. And we knew that at some point it would be a vaccine-preventable disease, which it now is. And so the newest efforts lie within our program here. So all of this to let you know that we have a very experienced team here at the State Department of Health, and every county in the state also has people through the Department of Health who understand how to do this work. To just level set a little bit, sometimes it's good to step back and see where we are with this pandemic. So 124 million cases in 192 countries so far, 2.7 million dead in the country, in the world so far. And you can see on the lower right, this yellow graphic here. These are the daily case counts. So you can see that at one point we were close to 1 million new cases a day across the world. We had this really nice decline in December, January, and into February of this year. But now we've started to creep back up again, and that's as we start to see new waves of disease going through, especially Eastern and Central Europe right now, and hopefully not coming here. And for those who like to compare this to influenza, I want to make it very clear that this is nothing like influenza. So we have had 5 pandemics that have affected North America in the last 102 years, 103 years. 4 of them were flu. We thought our next pandemic would be flu too, but surprise, it's coronavirus. But just to put into perspective why this pandemic has changed everything we know, is that the world hasn't seen anything like this in over 100 years. So again, 2.74 million dead in the world, 545,000 dead in the United States. When you look at the 2009 H1N1 swine flu pandemic that all of us remember, 500,000 global deaths seemed absolutely staggering at that time, and we have had more than that number of deaths just in the United States with this pandemic. We only had 12,000 deaths in the United States from H1N1 compared to 545,000 over the last year of COVID. So even back to the avian flu of 1968, the avian flu of 1957, we have far exceeded the number of global and domestic deaths for all of the pandemics, all the way back to the 1918 influenza. And I'm sad to say that I fully expect that we will see the U.S. deaths from COVID-19 eclipse what we saw in 1918 from that pandemic. Hopefully, we won't see anything close to 50 million global deaths, but I think we will get there in the U.S. And we have the opportunity to stop this from happening. And every day that goes by without having people take the measures that are necessary to keep this virus from spreading, and every day that goes by where we lack herd immunity through vaccine, we are losing people in the country and in the state. This is the epi curve of confirmed new cases for a whole bunch of different countries. We're in orange, so you can see that the U.S. far and away exceeds any other country on the planet for its number of cases. We have seen this nice decline finally for the first time really since about the middle of July, and hopefully we're going to continue to see that, although you can see it's beginning to level off. I left up the other countries just to show you that if you look to the right, most of the other countries in Europe are ticking up now, and then Brazil has continued to have some problems. They have their own variant there too. They are in an upswing in Brazil and continue to struggle. And then this other big hump here is India. And I don't want it to be lost on folks that India's population is about 2.5 times that of the United States. And yet, we absolutely dwarf the epi curve of what India has seen. They too, unfortunately, are starting to tick up right now. So it is concerning to see these countries beginning to see new cases and new local spread. It is something that we could have happen here as well. And in Tennessee, we have pretty much modeled the U.S. curve, and again, also experienced this nice decline, really for the first time in cases. In January, the lower graph that you can see with the gray bars is hospitalizations. At one point back in December, we were really looking at having to pull the trigger on opening up field hospitals that have been prepped in Nashville and Memphis to be able to handle overflow, because we had nothing left in the hospitals. We barely missed having to do that. We've had this nice downturn in hospitalizations, but now you can see over the last few days, we've begun to tick back up again in hospitalizations, in ICUs, and in people requiring ventilation. So it's worrisome to see that movement in that direction, where also a lot of folks are going to be coming back from spring break travels where maybe they haven't been the most careful. And so we are at risk to having a new surge if we don't continue to maintain those measures. There are lots of resources for families to help them get information that hopefully they can find trust in. One is from healthychildren.org, and in full transparency, it was mentioned that I'm on the board of directors of the American Academy of Pediatrics. This is the American Academy of Pediatrics parent-facing site, healthychildren.org. So there's lots of information there around COVID, but also around every other type of health condition. The AAP is a trusted, nonpartisan, unabashed advocate for children, and so that's always a good resource to send people to. Children's Hospital of Philadelphia likewise has their Vaccine Education Center, which has short videos, just 1 or 2 minutes about immunizations, and they also have COVID information there. And then there are resources from Vaccinate Your Family around COVID, things that you can put up on social media to encourage people to get vaccinated and to seek out quality information. So not everything is doom and gloom. As you know, we do have vaccines, 3 vaccines that we are rapidly administering to people across Tennessee. We have, if you're interested, published our COVID vaccination plan that is posted to our website. If you go to tn.gov/health and then click on the yellow bar at the top and then go down to that blue tile that says COVID-19 vaccine information, it has a little shield on it, and you can read the plan. It always has that draft mark across it because it's an iterative plan, and we actually just updated it on Tuesday of this week in our 7th version. And if you want to understand the thinking behind how vaccine efforts have occurred in Tennessee, you can read everything you want to know about that there. If you have not seen this before, this is our attempt to put a 55-page plan on one PowerPoint slide. And so the thing I want to point out first is that blue bar at the top that says equity is a cross-cutting consideration. We take equitable access to vaccine very, very seriously, and we've actually been lauded by the CDC, the former vice president, institutions like MIT and Boston University and Harvard as having the most scientifically sound and equitable plan of all of the 64 jurisdictions, which are states, territories, and tribes in the United States that are rolling out vaccine campaigns. So we take this very seriously. We want to make sure that anyone can access a vaccine regardless of their access to health care, their ability to pay. All vaccines are free to everyone. And we want to make those as accessible as possible. And so we've spent a tremendous amount of time on that. We started with these risk-based tiers that are in the blue vertical bars, first focusing on the healthcare workers to make sure that that infrastructure, when we were in that surge in December, could maintain itself, not only to take care of COVID patients, but also to take care of all the other illnesses that don't stop just because we have COVID, and also focusing on residents and staff of long-term care facilities. It's the deaths in long-term care facilities that were really driving mortality and also just illness and hospitalization in Tennessee. So we wanted to get them done first, also our first responders. And then we've moved through these different phases based on an individual's risk of contracting COVID-19 through their work or through their living situation. Very quickly, though, we realized that we needed to do more to capture people who were at highest risk of hospitalization and death. And that's when we instituted these age-based criteria back in December. First was 75 and older, and then 70, and then 65 and onward. As a state, as of last Monday, we are in 55 plus and phase 2 A and B, critical infrastructure. We have said that the entire state will be open to anyone 16 and older who would like to receive a vaccine no later than a week from Monday, which is April the 5th. But counties are able to move on their own accord. And so many counties in the state have already opened up to giving vaccines to anyone 16 and older. So even if Shelby County may not quite be ready to open to everyone, there is lots of availability of vaccine in the counties that surround Shelby County, where you can probably get a same-day appointment if you're interested in being vaccinated. So far, we have administered about 2.2 million doses. 1 in 5 Tennesseans has at least one dose, and that's including children who are not eligible to even receive a dose of vaccine. About 20 to 24% of our population can't get vaccinated with this. 62% of all people in Tennessee who are age 71 and older have been vaccinated at least once, and more than half of everyone over the age of 61 has been vaccinated at least once, so we're very happy about those numbers. 1.5 million people overall, and more than 750,000 people have been completely vaccinated at this point. We are very proud, again, of the equity work that we've done. So of the population of Black Tennesseans, we have vaccinated 12.5% compared to the national rate of 7.4%. We have also vaccinated more of the Hispanic population and more of the Asian population than has been done nationally. So we're quite proud of those statistics and the work that we've done in those areas. So I want to talk a little bit about vaccine safety, again, because this is a big question that comes up with, Operation Warp Speed. The name did not do us any favors because it made it sound like we were developing vaccines hastily and vaccines that might not be safe. So I want to let you know that every vaccine that we have put into use for COVID-19 has gone through the exact same process as every other vaccine you have ever received. So flu vaccines, measles, mumps, and rubella vaccine, rabies vaccines, hepatitis vaccines, they have all gone through the same process. And that is these 3 phases of clinical trials, first with a very small and brave population of people who are willing to get an injection of something that's never been used before. And those people are watched for a period of time to make sure the vaccine is safe, to make sure that the dose is right, that they don't get too much or too little, to make sure it works like we expect it to work, that it does the job that it's supposed to do, and to make sure that we know if there's any serious side effects that would make us decide that the benefit was not worth the risk. Once they get through that first phase, then they recruit several hundred people, and they go through the same process again, and then observe these people over time. And then when they finally get to phase 3 clinical trials months down the road, there are hundreds or thousands, or in the case of COVID-19 vaccines, tens of thousands, sometimes 40, 50, 60,000 individuals in the phase 3 clinical trials. And again, looking to make sure that the vaccines are safe and the vaccines are effective. Once all of that is done in the non-COVID world, that vaccine would go to FDA. They would decide to license it if the data supported doing so. And then at that point, the vaccine manufacturers would start producing the vaccine in mass quantities to be able to send it out. And it's that part, that that vaccine manufacturing part that takes so long. Vaccines are very expensive to manufacture. They don't make a lot of money for most of the pharmaceutical companies. They do much better making blood pressure medications and other things, Botox that people seek out, than they do vaccines. And so they don't want to put money into manufacturing millions or billions of doses of vaccines unless they know they've got one that's going to be approved. Otherwise, it's not worth their time and it's not worth their risk. What Operation Warp Speed did, the federal government did, was they took that risk away from the pharmaceutical companies. So these vaccines still went through the exact same clinical process, phase 1, phase 2, phase 3. Actually, you could argue that the phase 3 clinical trials were 4, 5, 6 times as robust as some of the other vaccine trials that have been done. But then what they did was they took the liability for the manufacturing of the vaccine off of the shoulders of the pharmaceutical companies. So they gave the pharmaceutical companies the money to begin manufacturing these vaccines before they were even approved, so that when they finally got FDA authorization for use, they were already stockpiled and ready to deploy, instead of then building the factories and the processes and getting the patents and getting vaccines bottled and shipped out. So by the time Pfizer and Moderna got through all of their phase 3 clinical trials, there were already millions of doses of vaccine ready and waiting to go. Now, in some cases, there has been loss of federal dollars because of this. The feds put money into Merck to develop 2 vaccines, and those did not pan out. They didn't make it through phase 3 clinical trials. They will never be used anywhere in the world. Merck has actually gone back to developing therapeutics. They're also going to help with the bottling, I think, of the Moderna vaccine to help them with their throughput. But those vaccines that were being manufactured of the Merck product are going to be destroyed and never released, and that's federal risk that was taken and not the risk on the company. So this is how we got things done more quickly, not because the science was rushed, but because the pharmaceutical companies didn't have to pony up the money and wait until they were 100% sure that they had a good thing before they could start manufacturing. The bottom line on vaccines, and there's a lot of talk about, which one are you going to get? I want to get this one. Every one of the 5 vaccines, 2 of which have not yet been approved in the United States, were 100% effective at preventing hospitalization and death from COVID-19. And no one who got the vaccines died because of the vaccines. So this is a really important message. What we want to do is stop people from dying, and we want to stop people from being hospitalized. And any one of these 5 vaccines can do that and do it very, very well. And so really what it then comes down to is, in some cases, convenience, because some vaccines are 2 doses and some vaccines are 1, and where your ability to access those different kinds of vaccines, and a lot of that relies on the supply that we get from the federal government. There are variants that have popped up for these viruses. As you know, there's the UK strain, the South African, the Brazilian. All of these variants are present in the United States. It takes a month or more to sequence these. So by the time we know that one of these variants is around, there's already been months of transmission of it. All of these vaccines will protect you from one of these variants better than not getting a vaccine. And so the worry about variants should not stop someone from getting vaccinated. Yes, at some point we may need a booster. It's looking more and more like this vaccine might be more like the flu vaccine, where we get one every fall. But every one of these vaccines is still likely to prevent serious disease and death, even from one of these variants, if you get vaccinated. And then quickly, I wanted to just kind of run through how mRNA vaccines work, because these seem to kind of wig people out a little bit, that it seems like, this is a technology that would interfere with my DNA or something. And so I want to just put all of that to rest. So mRNA is basically a recipe that is given through the shot to the body, and it tells the body to make the protein, the spike protein that's on the surface of the coronavirus. So everybody's seen drawing sort of like this, little coronavirus, got these little spiky things on it, and those are proteins. And so what scientists were able to do was to figure out the recipe for making that protein. And they put it into a recipe called mRNA. And so that recipe says, here, body, make this spike protein for a little while. So that recipe is put into the muscle in your arm, and it tells the cells in your muscle, in your arm, to, for a little short period of time, make this protein. There's no virus in this vaccine. All there is a recipe to make this protein that is found on the surface of the virus. And so as a result of this, your body says, that is not supposed to be here. I'm going to make antibodies to this protein because this is not a human protein, and I need to destroy it and take this out of commission. So you make antibodies as a result of that. The recipe disintegrates very, very quickly within hours. So you don't continue to make this protein. You only do it for a very short period of time. But what happens is that now your immune system knows what that protein looks like. And the next time it sees it, which would be on the surface of a coronavirus, it says, I've seen this before. I already have my soldiers all lined up. I'm going to go get rid of this right now and take it out of commission. And the body does that before the virus has a chance to make copies of itself and make you sick. It's really quite brilliant technology. And again, you cannot get COVID-19 from these vaccines. All it does is give you the ability to make an antibody against it. Similarly, the J&J or the Janssen vaccine, the Johnson & Johnson vaccine, works very similarly, except there's a little bit of a middle step in this. So again, we sequence the protein, you put it into a recipe. This time, we give the recipe to what's called a replicated defective virus. So it's an adenovirus, which causes the common cold, but it's been made in such a way that it can't make copies of itself, so it can't make you sick. They give the recipe to the little adenovirus, and that's what gets injected into your arm. And the adenovirus drops off the recipe to your arm cells and says, here, make this protein. The adenovirus gets taken out by your immune system. And then the same process happens. You make the antibody. Next time you see coronavirus, you don't get sick. So they're both very safe, very targeted, and they cannot give you COVID-19. So relative risk for some people who want to weigh risks and benefits, the risk of a severe adverse event from one of these vaccines is less than 1 in a million. The risk of death, if you live in the United States, from COVID-19 is 1 in 602. That's not the risk of death if you get COVID-19. That is the risk of death of being in America and dying of COVID-19 is 1 in 602. And for Tennesseans, that risk is 1 in 577. So you're being here right now in the state of Tennessee. You are one in 577 of you are going to die from COVID-19 versus getting a vaccine that may have an adverse event risk of 1 in a million. If you're a betting person, you understand those odds. After vaccination, common side effects are typical of what we see with vaccines. A little arm soreness, some redness. Some people will get a little low-grade fever and body aches and not feel very good, maybe for a couple of days, but then that goes away. Getting the vaccine does not change your testing. If you go on to get a PCR test, a nose swab, or a mouth swab, it's not going to make your test positive. And the really nice thing is that vaccine recipients don't need to quarantine if they get exposed once they've been fully vaccinated for 2 weeks. In the meantime, because those variants are out there, until we get enough people vaccinated, we still should physically distance and wear a mask and limit gatherings when we're around people who are not also vaccinated. So if you want to become a vaccine partner, there are ways that you can do that. There is a CDC agreement that you need to complete that's located on our website, tn.gov/health. Go down to the COVID-19 tile there, and it will take you to a provider tab that gives you the link to sign up to be a partner. It's really best if you have at least 100 people who are interested. That could be employees and their families or friends. If you're willing, if you have fewer than 100 interested, the vaccine comes in a quantity of 100. We don't want to waste it. So if you're a very small business, you may want to partner up with some other businesses and have one site, or I would suggest reaching out maybe to a local pharmacist that might be willing to come on site and vaccinate your employees. You complete the agreement. You have to register with tennis so that you can enter into the registration system anyone who gets the vaccine so that we have that record. You have to be able to store the vaccine, which means having an approved refrigerator and something called a digital data logger that costs a couple $100. And then once you complete that process, you can request to get vaccines. We send them to you and you can give them. If you're interested in getting started, you can email vaccine.onboarding@tn.gov and we can help get you started in that process. In the meantime, you can go to vaccinefinder.org to figure out where you can find a vaccine near you. You can select which vaccine you might be interested in, put in your zip code, and it will show you all of the locations that have vaccines in stock in that area, and also take you to their place where you sign up to get appointments there. And you can also go to vaccinate.tn.gov. This is how you get a vaccine through one of the 89 rural county health departments in Tennessee. And again, there is lots and lots of availability of appointments in West Tennessee. You just have to travel outside of Shelby County, and you can get an appointment with a local health department there. So vaccinate.tn.gov, you can go through and sign up. Even though we don't officially have everyone eligible by before April the 5th, you are able to sign up through this site and get an appointment regardless of your eligibility. And in the meantime, stay safe, get vaccinated, wear a mask if you're out, keep your distance if you're with people that aren't vaccinated, and make sure you wash your hands. And this is the number for our public information line, 877-857-2945. They can answer any question you have about COVID-19 or the vaccine, and are happy to talk with you. I think they're available 8 a.m. to 10 p.m. Every day. Give them a call if you have any concerns, and I'm happy to take questions. Thank you so much for your time.
We've got some great ones lined up, Dr. Fiscus, and I'll just go ahead and start firing them off to you. And folks, don't forget, you can just type them into the Q&A box for Dr. Fiscus or Dr. Nolan, whichever you like. Number one, can an employer require their employees to get vaccinated legally? And the follow-up on that was, what documents can be referenced to substantiate this?
So, you know, there have been some bills proposed at the state legislature that would prevent you from being able to do that. I think as of this morning, I heard that one had been recalled from that process. So there is nothing stopping you as an employer from requiring vaccination, just like you can require flu vaccination or measles vaccination or any other vaccination. I would caution a little, just because these vaccines are still under emergency use authorization, which means they have not gone through full FDA approval. They're still considered, I hate to use the word experimental, but they don't have full FDA approval yet. There also is, you know, some access issues still with vaccine, and so it's hard to require someone to get a vaccine when it is not fully readily available to every person who wants to get it. But the short answer is that yes, you can, if you choose to, require people to get vaccinated. I don't have supporting documents for that, but it's, you know, we are a business-friendly state in Tennessee, and you know, businesses have been allowed to make their own business decisions.
All right, next up, if the COVID-19 vaccine becomes a yearly necessity, could it be combined with the yearly flu vaccine?
Yeah, possibly. They'll have to do a whole nother group of studies with the same clinical trials to determine if those two vaccines can be mixed together or even administered together. Right now, we don't administer COVID-19 vaccine within 2 weeks of any other vaccine except hepatitis A. And the reason for that is because we're watching the data very closely around side effects, and we want to make sure that the information that we're getting is specific to COVID-19 vaccine. So if you get a fever after a COVID-19 vaccine, but you just had another vaccine within a couple of days, we don't know which one to attribute that side effect to. As we move through these vaccines, as they become fully FDA approved, then I'm sure there will be efforts to try to combine probably those two vaccines together so that people could get one shot each year. But I do think this will be treated very similarly to the flu. Unfortunately, vaccines are really good at mutating to avoid our immune system, and that's what the flu does too. And that's why every year the flu vaccine changes, because the vaccine is updated to respond to those mutating strains to keep us hopefully one step ahead of what they're doing. So I do think we're headed in that direction, and hopefully we'll see some combination vaccines later on.
Great. Let's see. What is the prediction on getting to herd immunity in Tennessee if the current vaccination pace continues?
So we're at about 20% right now that have one dose of vaccine. We really need to get to about 70%. And the problem with that is that, as I mentioned, about 24% of the state is not eligible because they're children, and we don't have vaccines that are approved for under the age of 16 just yet. So what that means is pretty much every person in Tennessee needs to get this vaccine. The faster we can do that, the faster we can get ahead of the variants and hopefully squash some of that transmission. So, we are trying to get people vaccinated just as quickly as we possibly can. We have had some supply issues. We are just now finally getting enough Pfizer and Moderna vaccine really Pfizer vaccine to be able to send it to just about anybody who wants it. Limited, though, by the fact that it comes in a package of 1,170 doses, and that's really challenging for people to administer 1,170 doses of a vaccine. We've been pushing Pfizer for months to get their packaging size down so that we can send 100 doses out to a place and get folks vaccinated. That still hasn't come. We are still a little short on Moderna doses for the demand, and then there's a lot of interest in the Janssen Johnson & Johnson vaccine because it is a one-dose vaccine. You get immune more quickly. It's one shot for people who don't like shots. We have had a slow drip of that vaccine in the state, about 7,600 doses at a time, which doesn't go very far. We did get about 30,000 doses this week, and they keep telling us that we've got a whole bunch coming, but we're still waiting to actually see that come to fruition. So we hope that Johnson & Johnson vaccine will allow us to get a jump on getting a larger number of people vaccinated, because we only have to do it once.
That leads in well to one of the other questions. When can they expect vaccines to be available for children?
So the Pfizer vaccine has been in phase 3 clinical trials for children down to 12 for the past several months. They've now closed that trial. They're analyzing the data, and they'll be applying for a change in their emergency use authorization from FDA. I expect that's probably going to be May, June, July, something like that. So we'll probably get down to 12. Moderna has just really started enrolling kids down to infancy. We probably won't see them get enough numbers and information on those populations to have a vaccine for younger school-age kids and toddlers and infants until probably early in 2022.
Let's see, we've got one more general question, and we've got two that are kind of local. Let's go there. Somebody's wondering, this may affect a lot of our attendees. Does taking a cortisone shot for knee pain interfere with the efficacy of the Pfizer vaccine? And should they wait 14 days after the cortisone before receiving a COVID-19 vaccination, or does it matter?
Yeah, it's a good thought. We do worry about systemic steroids because it does impact the way that you would respond to a vaccine. A localized shot in the knee is probably not a concern. If you wanted to wait a week or two, there's nothing wrong with doing that, but it's not a contraindication to going ahead and getting the vaccine. My husband had a similar question. He got a cortisone shot in his neck and wasn't sure if he should go ahead and get the vaccine or not. So I think those localized injections are fine. If you're doing like a Medrol dose pack or oral prednisone for a period of time, you should probably wait about 30 days after you finish that systemic steroid before you go get a vaccine, just to make sure that you mount the immune response that you want to. It's not that it's dangerous, it's just that you may not be protected as well as we would like.
I believe that's about all the time we've probably got for questions right now. So I'll go ahead and turn it back over to Mr. White. And thank you so much, Dr. Fiscus. We appreciate it. And thank you.
Yeah, my pleasure to be with you. Thanks.
Thank you all. Thank you, Dr. Fiscus. We really are quite appreciative of the presentation, and we really appreciate the partnership that we've had with Commissioner Piercy, the Tennessee Department of Health. They have been very responsive to requests that we have had, as we have made every effort to respond to the needs that we have seen outlined within our business community. But with that said, I want to thank Matt again, and I want to thank everyone involved for today's presentation as we come right up on 1 o'clock. We want to thank you for joining with us, and we're going to invite you to be with us for our next installment, which will be Thursday, April the 8th. So with that said, if there are any follow-up questions or things you'd like to share, please feel free to reach out to us via email, bwhite@memphischamber.com, bwhite@memphischamber.com. But we look very much forward to seeing you again. There we go. There that slide is. April 8th at noon, how to schedule the vaccine, and then April 22nd at noon, what to expect and general facts. So we appreciate you once again for joining with us today. I want you to mark your calendars for April 8th at noon, how to schedule the vaccine, April 22nd at noon, what to expect and general facts. And if you're like me, if it's happening at noon, you can find a way, even if you need to eat your lunch while enjoying great information from our presenters. So with that said, thank you all so much. Thank you again to all of our staff with Greater Memphis Chamber and University of Memphis. Appreciate the partnership. Thank you all for being on today. We look forward to seeing you again very soon.